Hey y'all, Julie here with Birmingham Mom Collective, and today we are here with two experts from UAB Medicine to talk about all about menopause and healthy aging, which is a great topic, and I'm very excited to talk today to Leigh Lorino, a nurse practitioner, and Dr. Margaret Boozer from UAB. How are you doing, ladies?
Good morning. Good.
Good morning.
Morning. All right, we're going to jump right in here, and this first question is, what are some of the first signs and symptoms that you are going through menopause? Who wants to go first?
I generally counsel women that an increasingly irregular and hopefully spacing menstrual pattern is the hallmark of moving into menopause. And we define menopause clinically as the absence of menstrual function for 12 months or longer. And so when a woman has met 12 months without menstrual bleeding, she technically meets the definition for having entered menopause.
Oh. Okay.
There are also, of course, many accompanying symptoms, but that's technically the definition of menopause.
Okay, so 12 months. So is there any symptoms leading up to that 12 months? Like I've heard a lot about perimenopause and things like that. So what are some of those signs?
We'll give that up to Leigh.
Okay. Usually as a company, like she said, we hope spacing out of periods. We typically see women, not all women, but a lot of women have accompanying hot flashes, night sweats, which leads to some insomnia because you're not sleeping well because you wake up hot and sweaty. You can have vaginal dryness associated with this. There are a lot of other, things I think that are out in the public eye right now in women's health and menopause and perimenopause that I think we associate with menopause and perimenopause, but more than likely it's just the aging process because the average age is 51. And as we age, lots of things happen in our bodies that we don't have a lot of control over.
Okay, so it could be aging and it could be menopause. Some of those things. Okay.
Although, mind you, they occur at the same time.
Right.
Okay.
So I also always want to emphasize that menopause is not an abnormal process or something that needs to be fixed or corrected. A lot of women come in with the idea that my hormones are out of whack. I would say that it's not wrong. It is simply a natural change that occurs. It's an adaptation of life. It is not something that is in error, so to speak. And so I think it is most important that we think about how we can help women move through this transition and feel as best as they can, but recognize that this is a new chapter of life. It's not one that will be completed. So women don't become menopausal and complete menopause. They become menopausal as a new stage of life.
New phase of life. Yeah, I like that. All right. So what age or when does menopause typically occur?
As Leigh mentioned, the average age is 51, but everything is, as always, a bell curve. So there are some women who may go into menopause as early as their early 40s or may not become menopausal until mid to late 50s.
Okay, that's a big range, 10, 15 year range. Okay. Okay.
And the peri symptoms can last anywhere from 3 to 7 to 5. 3 to 5 to 7 years. Some women don't have any symptoms, which is wonderful.
Wow.
I would tell those women, good for you. Be glad. Be glad. Be happy.
Yeah, that would be great. No symptoms. How long does menopause usually last, would you say, on average? Bell curve.
I say that generally the worst of the transition is a 2 to 3 year time frame. As I just alluded to, it is a new stage of life, so it is not technically complete.
Right.
It is simply that women are most symptomatic as the estrogen levels are declining, because this is about declining ovarian function as women move from a reproductive age of life to a postmenopausal non-reproductive, the ovarian function declines. And so as the estrogen levels decline, the symptoms are most noticeable and disruptive. And that, I say 2 to 3 years, but I would say possibly 3 to 5 years.
Okay.
But I think what she's trying to get at too is once you're there, you're there. It's not something you come out of. Once you're menopausal, you're always menopausal. This is where we are in our stage of life.
Yes. And so you mean like you might have symptoms for the rest of your life? Is that what we're saying?
It's just not as strong. So the symptoms still occur. I mean, my 88-year-old mother will still have a hot flush here and there, but they tend to be less frequent and less disruptive.
Okay. Got it. How can one manage the symptoms of menopause? Like you hear a lot about hormone therapies and things like that, or maybe better air conditioning if it's a flash, but tell us some of the things that have helped your patients.
Okay. I think it depends on risk factors. First, you have to look at kind of overall health of women, where they are in relationship to the last menstrual cycle being fully 12 months or not. If you're in the perimenopausal phase and you have no contraindications, you could really start back on birth control pills, which will help some of those symptoms. And a lot of women were like, I don't need birth control. But that's going to help your estrogen levels stay steady and not have significant fluctuations. If you're truly menopausal, and I'm going to preface all this, but I do think exercise and diet are huge. For sure, I think most women need to be on a good multivitamin and vitamin D every day for our bone health as we age. But you can also talk about add back estrogen therapy as well as progesterone therapy, depending on if you have a uterus versus not a uterus, and then you get into a different medication regimen.
Mm-hmm. I want to underscore what Leigh said about recognizing exercise and diet. Exercise has been shown to decrease the frequency of hot flushes. And certainly women will, as they move through this, recognize triggers, such as alcohol intake is not necessarily at the time, but alcohol intake is associated with a greater frequency of hot flushes. Regular exercise is associated with a decreased frequency of hot flushes. Obviously, exercise also gives so many health benefits, such as joint mobility, bone strength, balance, core strength, things that as women age later in life become especially important. So I completely agree with Leigh about emphasizing the healthy lifestyle that diet and exercise can bring. And then, of course, we always talk about layering clothes and layering bed linens, and having a fan available, things that are helpful when you are struggling.
Yes, helpful and practical for sure. What are some of the long-term health implications of menopause? So you said you're always in that stage or always menopausal, but what are some things to expect kind of in that stage?
I mean, I would think bone loss would be significant for women, because when we are not making estrogen, estrogen is very bone beneficial to women, which is why I mentioned a multivitamin with vitamin D. I think and vaginal health is very important as we age, and I know that's kind of not where this conversation was typically maybe meant to go, but vaginal health for women is very important as we age. Pain with intercourse can be important, and recurrent urinary tract infections in women as we age. And so vaginal estrogen is wonderful as we age in women with no contraindications. And most women do not have contraindications to vaginal estrogen.
But also menopause transition and menopause in general, whether it is menopause or aging, is associated with increased cardiovascular risk. So obviously cardiovascular risk being the possibility of coronary artery disease, heart attack, stroke. And so when Leigh refers to contraindication or risk factors associated with initiation of hormone replacement, that those health risks are things that we're considering when we're talking with a patient about possible HRT regimen.
Okay, great. Also, an added question. Do you still need to get a pap smear after you pass menopause?
Yes.
Yes.
Okay. So forever and always.
Not
Necessary.
forever and always,
Okay.
but pap screening guidelines, which is cervical cancer screening guidelines, are recommended to continue through age 65, as long as women have had regular pap screening and 3 normal, appropriately timed screenings in advance of turning 65.
Okay. All right, great. Well, there are some good things on the horizon for a lot of us looking that way. And so I'm excited to learn all of these things from you guys. Thank you so much for being here today. If you're out there today and you have a question, please put that in the comments below. And if you're looking for more information, you can head over to uabmedicine.org. Thank you, ladies, and we'll see y'all next time. Bye.
Thanks.